All right. Jumping on live this morning, Tuesday morning, to talk with you all about keto analogs. Uh, Before I get into all of the nitty gritty about that, I just want to let you know that this is a really big topic. I won't be getting into as many details as I possibly could, but I do have an article up on my website. So I will give you the link to that in just a second. For those of you that are watching live or replay, let me know in the comments so that I can see when you're tuning in and say hi. For those of you that are brand new to me and don't know who I am, my name is Jen Hernandez. I'm a renal dietitian. So I'm a registered dietitian that is also board certified in renal nutrition. And that is who I focus on for my private practice, which is Plant Powered Kidneys. You can find me on Instagram at Plant Powered Kidneys. You can find our Facebook group, Plant Powered Kidneys, and you can learn more from my website, plantpoweredkidneys.com. That is a really quick nutshell of who I am and what I would like to do for you, which is help with CKD. I used to be in dialysis, working there, helping people with their nutrition on dialysis, and I wanted to do more. I wanted to help people learn better changes before they got to dialysis, because that's something that is so common in the nephrology world is, don't worry, you'll have a dietitian when you're in dialysis. But we are dietitians that exist in the CKD realm before dialysis, where you can make a lot of really great changes to feel better and protect your kidneys. So I've had some questions about keto analogs, and I've put this question up to the group in Facebook, what they wanted to know. And that is what's really led me to want to talk with you about it this morning. So really quick, keto analogs are basically a simplified protein. So protein is really important for our body. It's one of the macronutrients. So we have protein, fats, and carbs. Those are the three big macronutrients. Alcohol is technically another macronutrient, but that's a whole other story. So what we're going to be focusing on keto analogs, which is a part of protein. So the keto analog concept is actually the protein amino acid, which is the building blocks of protein that's been broken down with the ability or capability or risk of nitrogen being removed from that molecule. So the keto analogs are considered a medical food, and this is something that will be really important to think about later if you are looking into it. But right now, it's thinking about it in the more simplified version of a really basic protein supplement, and this is for CKD. So with keto analogs, this is something that is or can be utilized with the low protein diet. So before I start diving into more details about the low protein diet, about keto analogs, I want to talk with you about the low protein diet pretty briefly. I do have a whole other article on plantpoweredkidneys.com about the low protein diet. So I'm not going to go so deep into it right now, but I do want to give kind of just an overview so that you can understand where the keto analogs fit in with this. So the low protein diet is something that is recommended by the KDOQI guidelines. And KDOQI is this international group that studies the evidence of what is best for kidney health from all stages, 1 through 5, dialysis, transplant, the whole realm. So what KDOQI recommends is to follow a low protein diet, which is defined as about 0.5 to under 0.8 grams per kilogram of body weight. And they find that this low protein diet is acceptable for stages 3 to 5, not on dialysis. So that's going to be the low protein diet. Now there's also a very low protein diet, and that's about 0.3 to 0.4 grams of protein per kilogram of body weight, in addition to the keto analogs. It's something really important because it is a very low protein diet, and our body needs protein. It is a macronutrient. Those amino acids do so many things for our body, so it is important that we do get them in our diet. So, hey, good morning. Good morning. Yes, it is. This is a pretty deep topic, you guys. So, bear with me as I go through and explain this. Again, there is an article on the website that is up right now. So, you can grab that from the website, plantpoweredkidneys.com, go to the blog, and it's the very top article that was just released this morning. So, anyway, we're going into really quickly low protein, very low protein diet. So, these are less protein. The general guidelines for protein in the typical person is about 0.8 grams per kilogram. So that is the standard. And then we go at low is just below that. And then very low is below the low, of course. The caveat for someone in these stages of CKD to follow the low or very low protein diet is it's best to be what they call metabolically stable. Now, what that means is that if you have diabetes, your blood sugars really need to be well managed, well controlled. So, like your A1C should be around the 7 range if you are to progress into a lower protein diet. And even so, there are special guidelines about the renal diabetic diet that don't qualify. This is like a subcategory. It doesn't qualify into this general category of the very low or the low protein diet. So that's a whole other thing. Other issues that can basically keep you from being deemed metabolically stable is any kind of illness that takes a lot from you. So, like cancer, something that is what they call a consumptive disease, which means it requires a lot more energy. And if we think about if it requires more energy, it requires more calories just to maintain homeostasis in the body, that's going to be really hard to put in a low protein diet or a very low protein diet on top of something that's really burning through a lot of calories. So they don't recommend that somebody follows this if they have a health issue that is going to make things more challenging, and then the benefits might not even be there. So you want to make sure that you don't have like any active inflammation, that you haven't been to the hospital recently. That can be something that is causing inflammation in the body before, during, and after a hospitalization. So make sure you've not had a recent hospital stay in order to move forward with this process. And you guys know I am I'm a registered dietitian, I'm a renal dietitian. I am slightly biased to having a dietitian on staff, but it is really, really, really important that when you're looking at something like this type of treatment, that you talk with your doctor, ask about working with a dietitian in this case. So this is going to be the low protein diet with keto analogs is going to be, like I said, stages 3 to 5 of CKD. That is the time to work with a dietitian. Any of that time, any of that area, it's a time to work with a dietitian because you have so many opportunities, no matter what stage you're in, to make changes. And if you're interested in following a keto analog and low protein diet, you're going to want to have a dietitian on board to make sure you don't overdo it on either side of things. So we're going to dive into what are keto analogs a little bit more. So again, keto analogs are part of the amino acids, which are the building blocks for protein. So they are the amino acid, but they don't have the nitrogen component, which is one of the characteristics of amino acids. So the reason this is good for CKD is, as many of you know from other videos that we've done, from other posts and things I've talked about, nitrogen is a component that will be accumulated through your blood test results. So your BUN, your blood urea nitrogen, will typically tend to go higher and higher during the CKD process as the nitrogen is collecting. This is one of the reasons why a low protein diet is recommended, to reduce that nitrogen. And then the keto analogs bring in the protein but don't increase that BUN. So this is something that can be protective in those lab results, protective in preventing the uremic buildup in the body. So there are, in the groups of amino acids, there are 2 categories of amino acids. There are essential amino acids and there are non-essential amino acids. Now, the essential amino acids, those are amino acids that are required from our diet. We need to eat foods that have these essential aminos because we can't make them in the body. So the 9 essential amino acids are, and I'm going to read this off because I used to have to memorize this in school, but if you don't use it every day, you're not going to keep it in your head. Histidine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan, and valine. Those are the essential amino acids that we need to get in our diet. The non-essential amino acids are amino acids that our body can make from other amino acids and these processes in the body that will form the amino acids. And those 11 non-essential amino acids are alanine, arginine, asparagine, aspartate, cysteine, glutamine, glutamate, glycine, proline, serine, tyrosine. There we go. And these are synthesized from glucose, except for tyrosine, which comes from phenylalanine. So, as I mentioned, keto analogs are different from those amino acids because of the nitrogen part being removed from them. So this is what in part deems it a medical food, that it's a protein, but it is specially formulated for people with chronic kidney disease to supplement their protein in their diet. So when should you take keto analogs? Now, this is very, very important because we're going to talk about the general concepts, the general stages and examples of when somebody can take keto analogs, but this is not a recommendation to anyone to go out and get keto analogs because, well, we'll go into many of those reasons, but it's really, really important that you first speak with your doctor before starting this. So I will be saying that a little bit through the video today to just serve as a reminder about that. Very, very, very important. So that being said, in some cases, people with stage 3, as early as stage 3 kidney disease may benefit from keto analogs. It's mostly seen in benefit if there's a big drop in GFR. You might start with stage 3. I typically will look at dietary changes first for stage 3. I do not jump into keto analogs right off the bat because it is not the first intervention that I see. I do not find adding the supplement in the beginning to be the right step. We do talk about things like starting with a lower protein diet, making sure we're looking at sodium, making sure, like mentioned, those blood sugars are well controlled before we look into anything with keto analogs. But there has been some research that stage 3 that have seen that has seen bigger changes in their kidney function may benefit. So if you're at stage 3, you may not be seeing a nephrologist yet. So it's important to talk to your primary doctor about keto analogs. They're probably not going to know about them, to be honest. Keto analogs are very, very new in the United States. They've been used for quite a long time in Europe, but here in the United States, it's a very fresh type of treatment. So they probably won't know about it, but you need to ask them. You need to bring up that conversation to let them kind of be more aware about it and let them look into it as well. But bring that up, ask them about it if you're at stage 3 and you see a big change in your kidney function. Now, more importantly, the keto analogs are seen with better results with stage 4 and stage 5. So stage 4 is GFR between 15-29, stage 5 is GFR under 15, qualifying for dialysis or transplant. This is where the low protein diet or very low protein diet can be really helpful. And in many cases, adding those keto analogs can be really protective in preventing protein wasting, muscle wasting, loss of lean body mass, and making sure that you get the amino acids that your body needs. So these are the groups in general, stage 4 and stage 5. I will again note that it's typically without diabetes that many studies are looking at keto analogs, but there are some that look at those with diabetic nephropathy or diabetes-induced kidney disease. There we go. I'm only 1 cup of coffee in my morning, guys. So Bear with me. But so stage 4 and stage 5, that's going to be the main group. And if you have diabetes, you may not be on as low of a protein diet, but maybe still have keto analogs. This is, again, where it really, really is important to work with the dietitian to find out if it's right for you. Because the last thing you want to do is think of taking something like this and end up causing more harm. This is not a magic cure-all for CKD. This is a potential opportunity to make improvements, but it's not something to just go. I mean, you wouldn't just start taking blood pressure medications just because you've heard blood pressure improvement helps with CKD, right? This is kind of that same idea. So the final group that may benefit from keto analogs are people that are on dialysis but still have residual kidney function. Now, in dialysis, we don't typically, and when I say we, I'm thinking to the years that I spent working in dialysis, and I would review all of the labs every week, every month. We wouldn't typically review kidney function in the lab test, because once somebody's on dialysis, honestly, to be pretty frank, it's kind of a moot point. Once you're on dialysis, that's enough kidney failure that your body cannot compensate. So some people can have residual kidney function, which is great. And it's more often common for those on peritoneal dialysis than those on in-center hemodialysis. Not to say that's not possible, but that's, from my experience, what is more common. But if you're on dialysis, if you're especially new on dialysis, and you can talk with your doctor about finding out about your residual function, also ask about keto analogs and if that would be beneficial. Dialysis is a very, very different diet from CKD. It's high protein, but the benefit with keto analogs, again, is that it's keeping the nitrogen down. And this is still a uremic waste. This is still toxins that the dialysis treatment would have to then get rid of. So the keto analogs coming in as a supplement can be beneficial in improving quality of life. So it's not necessarily the first method of treatment. It's not even the first recommended type of protein supplement in many cases, because, and I'll get into a little bit more about this here in a bit, keto analogs are crazy expensive, you guys. It's an investment. It really is. But depending on where you're at with your CKD, depending on where you're at with everything going on, it might be something that's worth that. It might be worth that expense for you if it's something that you can coordinate with your healthcare team to help delay dialysis or help you feel better. So when should you not take keto analogs? I touched a little bit on this, but if you have functioning kidneys, you don't need to take keto analogs. And I'm talking about the earlier stages, your GFR higher. It's not something that's going to be an intervention at that point. And if your kidney function is good, if you already have like maybe a transplanted kidney and everything's going well there, you don't need to take keto analogs. This has not been researched and it's not been proven to have any beneficial results. So in those cases, I'm not going to talk about a very expensive supplement of maybe it'll help. This is not the area for you. The other group, or the other thing to take into consideration, is if you have high calcium or high magnesium levels in your blood test, you will definitely want to talk with your doctor about keto analogs before starting with them. Honestly, no matter what, you should. But keto analogs are either calcium or magnesium based. So when they take out that nitrogen component, they have to stabilize it essentially. And to do that, they have to put in another type of molecule. So calcium or magnesium come in to help make sure that it's stable. So if you have high levels of calcium or magnesium, and then you were to take this supplement that's giving you more of these nutrients, that can really increase your risk of these high levels of calcium or magnesium, which neither of those things are good to have high levels of. So if that's your case, if that's something that you have a history of, make sure, please, that you talk with your doctor, talk with your dietitian about it first. But hopefully you're informed here, and we're going to talk more about those different types here. Okay, so let's get into some of the potential benefits of keto analogs. So this is the really exciting part, you guys, because there are some great studied benefits of keto analogs, and one of which, probably the top of everybody's brain, is that GFR. So Studies have shown that the use of keto analogs with a low protein or very low protein diet can slow GFR decline. So it can help maintain kidney function longer. But again, I can't say this enough. It's not just the keto analogs, it's the diet, the special diet that comes with it. And it's very, very unique. It can also help lower creatinine and BUN levels. It can help lower oxidative stress. It can decrease the risk of metabolic acidosis, which we've talked about in other videos about how CKD will push towards that metabolic acidosis trend, dropping your bicarb level. So this has been shown to help decrease that. Also, one of the great things that I'm such a huge fan of is it can help improve phosphorus and PTH, parathyroid hormone levels, which is really, really good for the long road. It is so important. Phosphorus is the silent killer of the silent killer. I've been saying that more lately, but it's so true. Phosphorus is something to pay attention to with CKD, but we don't really think about it until down the road. And then it's high, it's uncontrolled, it's causing problems. When if we had looked at it and been proactive early on, it could have been better managed for a much longer time. In dialysis, phosphorus is arguably one of the hardest things to manage. It is very, very tough to manage. It can also, keto analogs can also help decrease insulin resistance, which is really, really good for blood sugars. It can improve blood pressure. It can reduce proteinuria, which is the protein that leaks into the urine. And then, of course, because of a lot of these benefits, it can delay the start of dialysis. So there was a study that it was in 2018. They had a group following the low protein diet with keto analogs, and they did find that people also had a lower risk of mortality, of cardiovascular and cerebrovascular, like brain events like strokes and infection-related death. So this is really important to see because cardiovascular deaths is the #1 cause of death for CKD. You would think that it's related to something about your kidneys or, oh, I wonder if one of my labs got too high. It's the cardiovascular. That's the main cause of death for CKD because over time, it just is a lot of wear and tear on the cardiovascular system, which is your heart. So there was a study also published in 2021, this year, that found keto analog supplements reduce mortality in the pre-dialysis patients with diabetic kidney disease. So remember, I said keto analogs can be appropriate for people that are not on dialysis in those late stages. And with diabetes, you want to make sure that you have good control of your blood sugars first. One of the things I'm always promoting is addressing the root cause of your kidney disease, finding out what is causing problems to your kidneys, taking care of that first, and then advancing into these next steps of what you can do. So making sure that your blood pressure or your blood sugars are well controlled, and then looking into the potential of keto analogs may be helpful. So it's also important to know that a lot of these studies, a lot of the research that has been done with keto analogs has been focused on people with stage 4 and stage 5. So earlier I mentioned stage 3 as a maybe. There may be benefits there, but the research really has focused on stage 4 and stage 5. So that's why we talk about the group that will benefit the most, because that's what the research is showing us. Okay, so we talked about some of the benefits of what keto analogs can do, but like I said, it's not a magic cure-all. It's not going to fix everything. So some of the things that keto analogs have not been able to help include your cholesterol levels. Many people with kidney disease have abnormal cholesterol or lipid panels. Keto analogs are not shown to improve that. Albumin levels. I was just talking with somebody on Instagram last night about albumin. Albumin is a marker of inflammation. It can be associated with protein from the diet, but that's not the first step. The first step is to address inflammation. And if their albumin levels are kind of off, if they're down, it could be a sign of inflammation. And chronic kidney disease in of itself is inflammation. So it makes sense that albumin levels can be down. Another thing that keto analogs can't fix is anemia. Anemia, low hemoglobin levels, there is no evidence that's showing any improvement in those numbers, again, which is why keto analogs are part of a tool in the toolkit, but it's not the overall fix. Anemia is so, so important to take care of and pay attention to, because if your kidneys aren't getting oxygen, then what's the point? What are we doing all this work for because oxygen is required for the kidneys to do their job? So addressing anemia is very, very important. The other thing that the keto analogs were not shown to help was to make big changes to lean body mass or BMI. So it helps with the amino acid stores that do a lot of functions in our body, but it wasn't something to make significant changes with weight gain or weight loss. So I went through the benefits of keto analogs. I went through the things that don't work for keto analogs. We've talked about what they are, how they're different from amino acids. Now I'm going to really quickly dive into the types of keto analogs that are available. And this is specifically to the US. I did a little bit of research to see outside of that, but it's a bit harder with probably the internet access or something like that, that it blocks things that we just can't get a hold of. But the ones that I have here are the ones that I have recommended to clients, that I've used with clients, that I have pretty good trust in. So first off the bat is Keto Arena. Keto Arena is a calcium-based keto analog, and they have tablet and powder forms. So this is something that if you want to take a powder, this is the only kind that actually comes in a powder form. You mix it into 3 to 4 ounces of water or even some juice if you want, and you would take that with your meals. All of the keto analogs are taken with meals because you need that as part of your digestion coming in with, the rest of your macronutrients. So Keto Arena was developed by a board certified nephrologist here in the United States, and it has a nice list of keto analogs that are included in the product. I do have the full list on my blog. I'm not going to go through and read them because I don't think there's really a need to right now. But it's important to know that they have a starting dose of 1 scoop 3 times a day with food, or 3 tablets 3 times a day with meals. So again, it comes in tablet or powder form, whatever you prefer. Now, the cost of Keto Arena, you guys, this is not a cheap option, again, which is why you want to run it by your doctor first, your dietitian first. You do not want to be putting money into something that is not appropriate for you, because waste of money. Ugh. So at this time, Keto Arena is $145.50 per 90 serving canister. So that's basically a month supply. So about $150 for a month supply. They do, however, offer a discount, a 30% discount if you buy at least 2 canisters at a time. So if you get at least 2, this drops the price down to about $100 per month for the canisters. Now, the thing about Keto Arena is that it is it has low calcium and no magnesium. So this is something, depending again on if you have calcium and magnesium levels, you want to be aware of. If you have high magnesium levels, this could be a good option for you. The powder is a vanilla flavor, and the powder is equivalent to about 3 to 4 tablets of the keto analogs. Now, where to find Keto Arena? You want to go directly to their website, which is ketoarena.com. I have a link in my blog that you can go through if you like. It's not an affiliate link. I'm not getting paid for any of this. This is purely information so you can know about these different companies. But you definitely want to go directly through their website. You don't want to go through Amazon. You don't want to go through a third-party vendor, because you don't know exactly what the quality is of that product when you're getting it from a third party. So don't go that way. Go straight to the manufacturer. Now, another product is Albutrix. So Albutrix is a magnesium-based keto analog, and it comes in tablet form only. Now, the interesting thing about Albutrix is there's actually 3 different kinds of keto analogs within the Albutrix, and they have them based on the stages of CKD. So they have a stage 3, a stage 4, and a stage 5. Now, the creator of Albutrix is Lee Hull, who many of you probably, that name sounds familiar. He is a patient with FSGS, and he wrote the book Stopping Kidney Disease. So he's the one that was really passionate about looking into this and decided to create this product. So the Albutrix does have the keto analogs listed out. They have the other ingredients listed out as well. And I do have all of this on the blog. He also includes the nutrition information for calcium, magnesium, and nitrogen so that you know exactly how much you're getting in. Now, the value of that to you may not be very valuable, but to your dietitian, that could be helpful. So again, that's why it's really, really important to work with the dietitian so they can kind of see the bigger picture of this for you. For the dosing, according to the package, the dosing starts at 2 tablets 3 times a day. So they include nutrition information with this like daily dosing of 6 tablets to be taken across the day. So the cost of Albutrix at this time, 1 bottle with 180 tablets, which is approximately a 1-month supply based on that general dosing, is $199. Now, they do offer a discount if you set up a monthly subscription service, and then it drops down to $179. So it's $20 off. And then you would get the supplement automatically shipped to you. I think it's on like the 25th of every month to have that. But then you're paying every month for that. So just be aware when you set up that subscription that you're committing to that continuing price. So the interesting thing about Albutrix to me was that unlike Keto Arena has a keto analog that's for across the board, and the dosing is different based off of weight, based off of protein needs. Kind of similar to Albutrix. Albutrix dosing is a little bit different. They're looking at it by a gram protein measurement. So essentially saying you need to calculate how much protein you need and then subtract that difference from what you're getting in your diet to show how much you need to get from the keto analogs. Your dietitian, when you work with them, can calculate this for you and will tell you how many tablets or scoops you should be taking. So the different stages, I couldn't find stage 3 Albutrix information when I was looking in the details. It brought up stage 5 information, so I don't know exactly what's on there, but the primary difference between those different stages are what the keto analogs are bound to. So it has the magnesium for the S3, and then it kind of goes down on magnesium, getting towards stage 5, where the calcium base comes in. So that's kind of how it shifts between the different stages. So to get the Albutrix, you want to go directly to the Albutrix website and order straight from them. If you want to do the subscription, you can choose to do that. Again, these are pricey supplements. This is not something to take lightly. This is not something to just jump into thinking that you should do this. It's important to talk with your doctor about this first. Now, the last type of keto analog that's available, it's a little bit more challenging, and I'll get into that in a minute, is Ketosterol. So Ketosterol is a calcium-based keto analog, and it's created by Fresenius, which is a really well-known dialysis and renal company. And I do have the full listing of the amino acids on my article on the blog, and it has the nitrogen listing as well as the calcium content for these supplements. The dosing for Ketosterol, they do direct, it's quite high, 4 to 8 tablets 3 times a day with food. So with your meals, you would take 4 to 8, 4 to 8, 4 to 8. So that can add up to be quite a lot. This is also, it seems like the cheapest option, but because a box that has 100 tablets is $90. So you're thinking that's the cheapest price we've heard so far. But for a full month's supply with that starting dose of the 4 tablets 3 times a day, it comes out to $360 per month. So this is actually the most expensive option of all of them. The other thing about Ketosterol is it's kind of hard to find. There is a link on the Fresenius website to Ketosterol with the information, but there's no link to buy there. So in looking at where to buy, it's online pharmacies. And through those pharmacies, you do need to provide a prescription. So this is a keto analog that does require a prescription from your nephrologist. So this is the one I'm least familiar with because it doesn't have great accessibility. And a lot of these online pharmacies, I'm not totally trustworthy about. So I personally have never recommended this one. I've never dove into it, but I did want to give you all the information about it so you could learn more about it, talk about it with your doctor. Now, the labs to track. So the things that are really, really important when you are following the ketogenic, low protein or very low protein diet, you need to be on top of your labs. This is again why it's so, so important to speak with your doctor before you get started on this, because the doctor should also be on the same game plan as you and will need to be tracking labs to make sure you're getting enough nutrients and that you don't need to make, or maybe you do need to make dosing adjustments with your dietitian for these types of supplements. So the labs that you should talk with your doctor, and this information about these labs to track, I actually got from Keto Arena. These are the ones that their medical team has recommended be monitored. So first off, we have the CBC, your complete blood count. So this includes like your hemoglobin, your hematocrit, your white blood cells, red blood cells, all of that. Your renal function panel, magnesium, of course, magnesium we want to be tracking if that's included in your, if it's included in your keto analog, and if it's not included, it's important to see where your levels are out without the supplement. Your prealbumin, which is another structure similar to albumin, and your urinalysis. Now, those are recommended to be checked every 2 to 4 months, depending on what your doctor feels is appropriate. Other labs that should be reevaluated quarterly, maybe every 6 months, or even at least once a year, can be your albumin to creatinine ratio, your protein to creatinine ratio, your iron levels, your intact PTH, that parathyroid hormone, your vitamin D, if you have diabetes, your A1C, and your lipid panel. Again, keto analogs are not going to be helping with the lipid panel, but it's important to be tracking that because you might have other interventions that are there in place to help with your lipids. Okay, so I'm going to really quickly check into the chat. I know there's been some questions that have been coming up. All right, so Susie, the amounts that are determined with keto analogs is a calculation based on your protein needs, how much you're getting from your diet, and then covering that keto analog. So I will see if I can include some examples in a bit, but it's a bit complicated, and that's really why it's so important to have a dietitian on board, because we can go through the process of calculating it based on the diet, looking at what you're eating, what you should be eating, what your needs are, because it's a bit. So Tara, is low protein still advised when the diet is completely plant-based? Yes. Actually, low and plant-based diets, one of the benefits about a plant-based diet is that it can really kind of naturally gravitate towards a lower protein diet. Some people do easily get, plenty of protein in their diet from plants by eating more legumes and beans and nuts and seeds, things like that. But if you're following a plant-based diet, it should really start to kind of lower your protein needs already. Not to say it is a defined low protein diet, but you have a good chance that it's already lower. Let's see. So Ketosterol for stage 5 is a possibility. You definitely want to check with your doctor about that and see if it is something that is appropriate for you, because there are certain qualifications like being metabolically stable that you will want to make sure that your doctor is aware of and on board with. And as I just mentioned, all of those labs that should be tracked, you definitely want your doctor to be putting in standing orders to get those labs routinely monitored. So if your doctor is not aware or not recommending a keto analog, make sure you have a great understanding as to why. Don't let the conversation just end with no, because if it's a no because I don't understand it, that's a different issue. So find out exactly why, because they might have a really important justification as to why you shouldn't be taking them. Let's say your blood sugars are really uncontrolled, and we know that that's not the best time to be starting keto analogs. So if that is the issue, then the doctor might say, yeah, your A1C was 8.9. This isn't the time to be putting in keto analogs into your diet. So make sure you understand that. Again, if it's no because I don't know, like the doctor's not familiar with keto analogs, as many doctors are not, nephrologists are not familiar with keto analogs, then see about getting a second opinion, asking if they can refer you to a nephrologist that is familiar with keto analogs, because it is ultimately your health that is the focus, right? That's what it's all about, your health. And if that doctor is not aware of this as a possibility, it's important that you see a doctor that is aware, or get that second opinion just to get from somebody else's perspective of if this is something that is right for you. And if they say no, then maybe your other nephrologist is going to be still really great to work with, because the keto analogs are not going to be a part of your treatment plan. So the keto analogs for IgA nephropathy, I believe, is what we're looking at here. IgA nephropathy, it's a possibility. It's not necessarily a guarantee. Many of the studies are just looking at the more standard CKD caused by high blood pressure, diabetes, but it is still a possibility. So I'm not saying entirely no, I'm not saying entirely yes. I can't say yes or no to anybody, especially here in this area, because I don't know your health history. I don't know what's going on for you, and I'm not even legally allowed to say if that's okay or not. So you definitely want to ask your healthcare providers, ask your doctors, ask your nephrologist if keto analogs would be a good course of treatment for you to help keep your kidney function. And keto analogs, while they are newer, they are coming out more and more frequently, and I think they're talked about more now. So your doctor may have heard about them and just not quite aware of them. So this is a great invitation to ask your doctor for a referral to a renal dietitian who can dive into the low protein diet, can dive into the keto analogs with you, and really help support you in making that transition. Okay, so I do have some other questions about keto analogs that people have asked from the Facebook group, and things related to this idea of keto, if you know what I mean. I do have those Q&As listed at the bottom of the blog. So right now I've got to wrap things up. We've already, it's been 45 minutes. We've been talking about keto analogs. This is a really, really big topic, you guys. So be sure to check out the article that I have on my website. It's plantpoweredkidneys.com/ketoanalogs. You can just go to plantpoweredkidneys.com and click on the blog, and it'll be the first one to pop up. You can go check it out there. And if you want to hear me talk about it more, I will be right here again live tonight, but on Dadvice TV. So you can feel free to jump on then and to hear more about keto analogs when James and I talk about them. So that is all I have for you guys tonight. Oh my gosh, you guys, I'm only one cup of coffee in. So I hope you all have a wonderful rest of your day. I've got to get going. I've got clients to see, but I will see you all hopefully tonight. And if you have questions, drop them in the comments, or better yet, drop them in the blog, because that is where I love to answer questions, especially when they're related to the topics that we talk about. All right. Have a wonderful rest of your day, and I'll see y'all later.